Hi, everyone. Thanks for being here today for our conversation about becoming an employer of choice, the no-cost strategy for nurse retention. Conversation with HealthStream and Chamberlain University. Thanks for being here. There's a recently released job insights report for spring 2024 that paints a complex picture of retention as organizations struggle to fill positions. The remaining employees are the ones left to carry the weight. It's more pivotal than ever for companies to find ways to mitigate these challenges. And the report also outlines suggestions for culture improvements, things like placing more emphasis on mental health and prioritizing DEI, health equity, and belonging. Given razor-thin margins and consistently being challenged to do more with less, everyone is looking for no-cost strategies that have a positive impact on retention. So today we're going to talk about culture's impact on nurse retention specifically, and the key elements of an inclusive work environment. Supporting our conversation today with extensive backgrounds as executive leaders and culture curators in the workplace, I'm thrilled to welcome Dr. Lois Lopez, Chamberlain's DEI Council Chair, and Dr. Sally Carlisle, Director of Nurse Faculty Fellowship for Chamberlain's Office of Social Mission and Academic Excellence. Thanks for being here today. So inclusive culture is a common term used by healthcare leaders in their top initiatives for 2024. Many are emphasizing culture to attract and retain nurses. And I'd love to ask you both, what are some of the hallmarks for inclusive culture that organizations should be working towards? And what are some no-cost steps nurse leaders can take to achieve these hallmarks? Sally?
So that's a great question. There are many things that we can do, and they don't have to be difficult or costly at all. Very simple. And I'll go through them sort of on a continuum because I think there are places we can start down to where our goal is. So the first thing is respect and valuation of differences. So an inclusive culture recognizes and values unique perspectives, experiences, and talents of each individual and what they bring to the organization. And it encourages open dialogue, active listening, and willingness to learn from one another. The next step, so if we value differences, then we can start thinking about inclusive communication and language. So an inclusive culture fosters communication practices that are respectful, inclusive, and free from bias or discrimination. And sometimes that takes a little bit of self-reflection and being open and honest about where those biases might live in us that we don't realize. But it includes using gender neutral language, avoiding offensive or insensitive terminology, and promoting clear and accessible communication channels. So with those first two things, then we can start moving through diversity and representation. So if we are respecting value and we are communicating clearly and inclusively, then we really have begun to create a space where we're really focusing on diversity and representation. An inclusive culture values diversity and ensures that individuals from various backgrounds, ethnicities, genders, ages, abilities, and on are represented at all levels of the organization, including leadership positions. And so again, if we're doing those things, then we've created an environment that has psychological safety. So an inclusive culture cultivates an environment where employees feel safe to express their opinions, ask questions, and voice concerns without fear of retaliation or negative consequences. So for example, Lois can come and say, "Hey, Sally, what you said made me feel this way," and I'm going to listen and say, "Wow, I hadn't thought about that," and then think about how my bias or my experience may have influenced my comment or action, and then do better next time. And then equal opportunity. So an inclusive culture promotes equal opportunities for all employees, regardless of their personal characteristics or backgrounds. This includes fair hiring practices, equal access to training and development opportunities, and equitable compensation and benefits. And again, this is where sometimes that bias can creep in, or, where not having representation in leadership can begin to maybe make us not reach that goal of having equal opportunities for everyone. And then the last I would say to that point is continuous learning and education. So an inclusive culture promotes ongoing learning and education opportunities for all employees to enhance their understanding of diversity, equity, inclusion, and belonging principles and practices. So, even though Lois and I are experts, we are still learning new information and new language to use, and constantly assessing our bias and thinking about where our assumptions might be showing up with the people that we work with.
Thanks for sharing that. And theoretically, if an organization goes through all those things, we would see their nurse retention improve, right? But beyond retention, what are other benefits for promoting an inclusive culture?
So, the big thing, maybe not so much a benefit, but a call to action. The Future of Nursing 2020-2030 clearly states that we as nursing professionals have an obligation to ensure a workforce that is diverse and prepared with the knowledge and skills to address social determinants of health. And additionally, the report highlights the need to address the well-being of the nursing workforce. So supporting an inclusive organizational culture is one important step toward improving the well-being of nurses. Additionally, the American Nurses Association National Commission to Address Racism in Nursing came right behind that report and called for organizations to look for and eliminate racism in policy. And they found that racism in the work environment is impacting staff retention, as well as physical and psychological safety. The report highlights the need to create a culture where all staff and patients are treated fairly and have the opportunity to provide their perspectives and input on how organizations can create a more inclusive culture.
Thanks for sharing that. Really important stuff to take away from our conversation today. But let's take it to action. So where should leaders begin, right? There's a lot we can do there. What should healthcare leaders consider in their strategies to promote inclusive culture as they move forward into 2024 and years to come?
Well, that's also a great question, and I think Sally got us off to a great start there. And I want to take us to authenticity, right? So it's one thing to do the things that we talked about, but it's another thing to be authentic about it. And your staff, your employees, your colleagues can feel when you're being authentic. So some key elements and strategies that leaders should really look into when they want to create a more inclusive environment, an inclusive culture, is really start with a clear vision and commitment, right? So leaders must articulate a clear vision and demonstrate an unwavering commitment for that inclusive culture. So an unwavering commitment to diversity, equity, inclusion, and belonging. And with that, you need to start with conducting an organizational assessment. So perform that comprehensive assessment, understand the current state of affairs when it comes to diversity, equity, inclusion, and belonging within your own organization. Survey employees, maybe analyze the demographic data that you have available, review your policies and practices, and then also identify potential barriers or areas for improvement, right? So once you conduct that needs assessment or that organizational assessment, then develop a comprehensive DEIB, diversity, equity, inclusion, and belonging strategy. So what are the things that you want to accomplish? Develop those action plans and tailor them to the unique needs of your organization. And then once you have that strategy, make sure you establish accountability and governance, right? So create a dedicated DEIB team or committee that's going to be responsible for overseeing the implementation and monitoring of the strategy that you guys came up with, right? And as Sally alluded to, prioritize leadership diversity. We want to make sure that the leaders are representative of the colleagues and workers that you have working for you, because an inclusive culture not only includes your colleagues and your workers, but when the public sees that you are inclusive and you that's your culture, then they want to associate with that, right? So they'll more likely go and buy your product, go to your hospital, things like that. So prioritize leadership diversity, and then make sure you're implementing inclusive hiring and talent management practices. So review and revise your hiring, promotion, and talent management processes to ensure that they're fair and equitable and free from bias. Um, And then you want to also include ongoing training and education, just like Sally said, that while we are experts, we're still learning every day. And these are the only things that are going to make us better because, changing culture starts with the individual, right? So we have to recognize that there are things within ourselves that maybe could be improved upon. And when we do that and we become better, just human beings, then that translates naturally to our work environment, right? And we want to elevate others. So ongoing training, not only for the staff, but for the leaders as well. So foster those inclusive leadership behaviors. And again, as Sally spoke to, create those safe spaces where you can foster open dialogue and feedback channels so that employees have opportunities to share their experiences, share their perspectives, share their concerns, and that they're going to be heard, and they felt like they're going to be heard, right? So, and then maybe you want to celebrate and recognize the diversity, not only that you currently have, but as you start to retain more diverse, workers, we want to celebrate that, recognize the different backgrounds and cultures and experiences of the employees or the patients that you serve. And this can be easily done through cultural events, heritage months, employee spotlights, recognition programs, and things like that. We have to remember promoting an inclusive culture in healthcare is an ongoing journey that requires sustained commitment, leadership, and a willingness to continually learn and adapt. By prioritizing these key elements that we spoke about today, leaders can create an environment that values diverse perspectives, fosters a sense of belonging, and ultimately improves patient care and organizational success.
Well said. Thank you so much. I love the term learning every day. I love that so much. Dr. Lopez, Dr. Carlisle, thank you so much for this wonderfully insightful conversation today. For those watching, we hope you'll share this information with others at your organization as we all work together to foster a culture of inclusivity and belonging and improve care outcomes. Thanks for watching.